All right. Now this next concept, the next minimum set aside is a fairly new one. It's called the average.
Wendy, you do have quorum, although Richard is not quite on yet. So you can wait for another second, or you can go ahead and get started, whichever you prefer.
Morning, Katie. Are we ready? Do we have quorum?
You are good to go.
All right. Good morning, everyone. Thank you for attending the Maricopa County Regional Continuum of Care Committee. For all participants, please mute your phone or computer when not speaking, and please do not put your phone on hold. For all participants, we ask that you please identify yourself when speaking, and as a reminder, committee members, please do not use the chat feature as it is not available for the public to see. This morning, we want to welcome Nicole Gibson with UMOM's Day Centers. She is taking Tisha's seat, Letitia, on the committee moving forward. Welcome. Is she here? Nope. Know that I see her. Anyway, and we will now ask Katie to proceed with the roll call. Please indicate you are here and your organization after Katie calls your name. Go ahead, Katie.
John Bogart. Sorry, John Bogart.
I'm here. Sorry, it just took me a minute to do the unmute. Dawn Bogart, CEO, Homeless Youth Connection. Good morning, everybody.
Melody Boyer.
Good morning, Melody Boyer, Department of Veteran Affairs.
Vanessa Carthel.
Good morning, this is Vanessa Carthel with ABC Housing.
Sylvia Chavez.
Sylvia Chavez, Arizona Department of Education, the Homeless Education Project.
Allison Cook Davis.
Hi, sorry, I was just fixing my video. Morrison Institute for Public Policy.
Erin Cohen-Haig.
Good morning, here, Erin Cohen-Haig, Save the Family.
Jessica Cruz.
Good morning, can you guys hear me? Okay, Jessica Cruz, Housing Authority of Maricopa County.
Kathy Dinolfi.
Good morning, Kathy Dinolfi in Newly.
DC Ernst. Nicole Gibson.
Nicole Gibson, UMOM New Day Centers.
Anne Marie Johnston.
Good morning, Anne Marie Johnston with Community Bridges.
Christina Lopez. She was having technical difficulties. Marcy McFarland.
Marcy McFarland, Director of Housing, Home Inc.
Jim McPherson.
Good morning, Jim McPherson, Phoenix Community Alliance Social and Housing Advancement Committee.
Jennifer Page.
Good morning, Jennifer Page, Housing Administrator for Mercy Care.
Nikki Ramirez.
Nikki Ramirez, Chicanos por la Causa.
Ty Rosensteel. I see you on, but we are not hearing you, Ty.
Oh, I'm sorry. Can you hear me now?
Yep.
Perfect. Hi, everybody. This is Ty Rosensteel. I'm the Director of HMIS and Database Resources at Solari.
Shayla Schuster.
Sheila Schuster from Community Solutions.
Sarah Sims.
Good morning, Sarah Sims, Phoenix Elementary School District number 1.
Kimberly Thompson for Laura Scott Mickey.
Kimberly Thompson, Southwest Division, Salvation Army.
Lynn Spillers.
Hello, Lynn Spillers, City of Mesa.
Michelle Stokes.
Michelle Stokes, CEO, Behold Charities.
Craig Tripkin.
Again, Central Arizona Shelter Services.
Jocelyn Wilkinson. I think she is coming from another meeting. Chair Richard Cruz, co-chair.
Richard Cruz, Human Services Campus, here.
Co-chair Wendy Johnson.
Wendy Johnson, Justice Center, present and now on my cell phone.
Awesome. Thanks, co-chairs. Back to you.
Wow. Thank you, everyone, for being here. We are asking for the call to the audience. Please remember that members of the public were given an opportunity to submit written comments relating to this meeting and to azmag.gov/comment within 1 hour of the posted start time for the meeting, or attend the meeting through public posted Zoom registration. If you have joined the meeting and wish to share comments at any time, please use your raise hand feature in Zoom. Meg staff, were there any comments received or anyone who has joined the call to offer comments today?
Co-chair Johnson, at this time, there were no comments received and no one in the audience has raised their hand to offer comments.
Wonderful. All right. We invite you to do that at any time. Next up is our approval of the January 12th meeting minutes. Do any members of the committee have questions or comments on the minutes? Katie, I can't see everyone to know if there's hands up, so.
I don't see anyone raise hands at this time.
All right, then could I have a motion to approve the January 12th, 2022 Maricopa County Continuum of Care Committee meeting minutes as recorded?
I make a motion for the approval.
Thank you. Can we have a second?
I'll second.
Schuster from Community Solutions, second.
Thank you. Is there any discussion regarding the motion? Not everyone at once, please. No, just kidding. Okay, now I'll ask Katie to proceed with the roll call vote. Please indicate clearly how you vote, yay or nay, after your name is called. Katie?
John Bogart.
Yay.
Melody Boyer.
Yay.
Vanessa Carvel.
Yay.
Sylvia Chavez.
Yay.
Allison Cook Davis.
Yay.
Aaron Cohen-Haig.
Yay.
Jessica Cruz.
Yay.
Kathy Dinolfi.
Yay.
DC Ernst. Nicole Gibson.
Yay.
Anne-Marie Johnston.
Yay.
Christina Lopez. Marcy McFarland.
Yay.
Jim McPherson.
Yay.
Jennifer Page.
Yay.
Nikki Ramirez.
Yay.
Ty Rosensteel.
Yay.
Shayla Schuster.
Yay.
Sarah Sims.
I have to abstain. I wasn't at the meeting.
Laura or Kimberly Thompson for Laura Scott Mickey.
Yay.
Lynn Spillers,
Yay.
Michelle Stokes,
Yay.
Craig Tripkin,
Yay.
Jocelyn Wilkinson, co-chair Richard Cruz,
Yay.
co-chair Wendy Johnson.
Yay.
The motion passes unanimously with one abstention. Back to you, co-chair Johnson.
Thank you, everyone. We will move on to the next agenda item. I'm handing it over to Richard.
Morning, everybody. So we know that we have, various subcommittees and members to provide a brief verbal update on the recent activity as well as legislative activity. What I just want to stress with that is that we want, when we're talking about brief, it's less about the brevity and more about what really needs emphasis. So the written updates were in the packet, including an update on racial equity. The data subcommittee is currently recruiting members and the application closes on Valentine's Day. So if you've ever wanted to share your love for spreadsheets, now's the time to be somebody's data Valentine. The data subcommittee, so please forward the application to anyone that you think would be a good fit. Does anyone have any questions about the update memo? So I hear none. So we'll move on with the next agenda item. The next agenda item is the quarterly synthesis and communication of data. TJ Reed, Regional Homelessness Project Manager over at MAG, will provide an overview of the process, timeline, and data that is included in the quarterly synthesis. After TJ's presentation, we will have a keyword discussion, I like that word, about the communication around the data and the next steps. Go ahead, TJ.
Thank you, Mr. Chair and members of the committee. We're pretty excited, y'all, to go through the quarterly synthesis. So for those, basically what we wanted to do is, since there were discussions that were had prior to many of you being on this committee, we wanted to lay sort of a foundation of what we're talking about. And so a little bit of context, the HMIS team put together a dashboard that we've shown this committee multiple times, and we had a good conversation last time, the system flow dashboard that was showing, our inflow and our active and our outflow, and hopefully you all remember that visual. And so what was agreed to by the board and this committee several months back was that rather than posting that just publicly and saying hey, everybody, check this out, this is what it is, everybody sort of thought and voted that there was more sort of narrative and description and interpretation needed. And so every quarter, MAG, working with you all, with the board, with the HMIS team, is putting together a summary of that data for the last quarter to show where are we at, what are things looking like in terms of trends. It's going to also show system performance measures. It's going to also show some demographic information. So there's a lot that will be shared with you all. And so basically, in terms of the process and what we want to do over time is every month, the dashboard will be showed to this group and feedback and questions will come up. Those questions and feedback will then go to pull in data requests, add narrative to the synthesis that will be produced quarterly and shared with this group so that you all then can not only take it and understand it yourselves, but share that out to anybody who's interested. In terms of where we're at in the time frame, the quarterly synthesis will be presented to the board at the end of this month and to you all at your next meeting. So really exciting, y'all. I think this is a good consolidation of a lot of data that is sort of just like a one-stop shop. It is not exhaustive or inclusive of everything, but it is a really good way to understand kind of the current status in the system by just looking at this document. It's 4 pages and it will have lots of visuals to make sure everything makes sense. So with that, Katie, I don't know if we want to do anything else with that at this point, but that's sort of the process, y'all. And like I said, next month, prior to the meeting, you'll receive that in the notes for you to review. We welcome your feedback and questions and comments on it, because again, this is really our emphasis for the continuum to not discount the point in time counts, but to focus more on an inflow and outflow perspective of what's going on in our system, because it's more regular. All right, and with that, back to you, Mr. Chair.
Awesome. So thank you, TJ. What questions, I'm not going to say, are there any questions? Because I know you all have questions. That's why we're all here together today. So what questions or comments from the committee do we have? And does anyone have any further thoughts about the communication from the committee? I know it's stirring in your minds.
Richard, this is this is Wendy Johnson. I'm curious, TJ, what the lag time is on this report. So if it's a quarterly report, how long before we get it?
Yeah, great question, Wendy. So basically, what will be produced in February is for the last quarter of calendar year 2021. So to the board in February. And so just so you know why that is, the dashboard, which is the base of this, is updated by the 15th to the 20th of the following month. So that means that January 15th to the 20th is when all of the data for the December is kind of updated and included. And then from there, we're really working with you and all the rest of the subcommittees to update based on the questions that have been received, to be able to incorporate what needs to be done. And then we have some like a week time period or a couple of week time period for MAG staff to actually put together the visual. So it's effectively like 2 months after the quarter that it will be provided. But knowing that the system flow dashboard is available to this committee, you can see that the updated figures right now if you want. So right now you can see, or basically in 6 days, you'll be able to see the data for January as well. So for you all, it's both, right? You can go to the dashboard and look at it all yourself. And then also the system flow synthesis will just be done with a 2-month rolling period behind the quarter that we'll be reporting on, if that makes sense.
Thank you, TJ.
Is the quarterly report generally for the general public, or is it just for the committees?
No, the dashboard is for the committees only and the subcommittees. This synthesis is meant to be more broadly shared, that it has narrative and things that sort of interpret and explain versus just saying, hey, here's a broken line chart, like good luck understanding what that means, right? So yeah, this one will be meant to be pushed out like to media and other things like that.
Super, thanks.
That was kind of my question, TJ. But like also curious, just like on a little bit more of that strategy to make sure like the general population understands the work that we're doing with homelessness. And I'm not trying to get political, but I am very concerned about like the commentary that was made recently by one of the gubernatorial candidates on her homeless policy. I don't know if people saw that, but it has like terminology that's really derogatory to people that are experiencing homelessness at this current time. So to me, it seems like this comms and like really highlighting what we're doing as a community is like more critical now than it ever has been. And the messaging that's getting across, and like also like, I don't know if there's ways to combat even some of that negativity of how people are talked about. But anyway, just seeing a lot of concerns, and then knowing that data is a really powerful tool that we have to combat some of that.
Yeah, no, 100% agree, Chayla. And I think one of the things that we'll count on you all to do is to provide feedback on that messaging as well. So when you see it, there are words or things that stand out to you that's like, hey, we need to adjust this, work within this committee and and within those circles that are going to be reviewing this to provide that feedback, because we wanted to get this thing moving, and it's already been, we provided our initial draft back in October, I think, of the previous quarter, and solicited some feedback from this group and the board of like, hey, how is this looking? Does this make sense? But this is an iterative process, right? This is something that we constantly want to be adjusting and making better. So if there are flaws in it, or there are things that can be improved, or messaging items that can be shifted around to make more sense and combat some of the items that you're talking about, I think we would definitely want to do that. And I also think there are several efforts going around right now about politically just messaging homelessness and affordable housing that fit really with what you're saying too, of just public education campaigns and making sure we're all sharing the same language of how we're talking about homelessness and affordability, so that, yeah, we're united front, I guess you could say.
Hi, TJ, it's Sylvia Chavez from ADE. I was wondering, with that important information and us being new, is there a chance we could get the synthesis a little bit sooner than the day before the next meeting?
Sylvia, great question, and good to see you as well. I think what we can do, what might be useful, Katie, is if we send out the previous draft, and then the idea would that it'd be sent out with your packet. So I think that's like a week before. But honestly, I think that can be up to you all and Katie as to when that goes out to the committee. As soon as it goes to the board and the board is like, you're good to go, we can send it out to all of you, right? So that you can take it. So we'll send out the old draft like as soon as Katie's ready for it, and then the new one right after the board.
Thanks, TJ. If I can just jump in, the board, it'll go to the board on the 28th of February. So as soon as that's approved on the 28th, I can send it out to the entire committee as soon as the 1st of March. And then you all will receive it in your packet on the 2nd as well.
So do we have any other questions? Okay, so if no other questions, thank you, TJ. And we will move on to the next item on our agenda. We'll talk about the system flow dashboard and the race equity data review. The Homeless Management HMIS team developed a dashboard that explores the inflow, active and outflow within the homelessness system. The data will be reviewed on a monthly basis at this meeting. In addition, there was a data request to break down the subpopulations by race to better understand the demographics of each subpopulation during the last committee meeting. Ty Rosensteel will provide a synopsis of those findings. The committee will discuss the next steps for addressing the race equity findings included in the packet, are also the race equity provider toolkit for agencies to evaluate race equity in their programs and to begin addressing those disparities. TJ Reed and Ty Rosensteel, who are the Director of Database Resources and HMIS at Solari, they're going to provide a recap of the system flow dashboard and a breakdown of the subpopulation data by race. After reviewing the dashboard and presentation, we'll, again, my favorite word, discuss those next steps included in the agenda packet, as stated before, is the race equity provider toolkit. So lots of stuff for us to get into. Let's go ahead, Ty and TJ, it's all yours.
Hello, thank you, chairs and members of the board. This is Stephanie Crum with Solari, manager HMIS. I'm going to actually present this data here for Ty real quick. Is it okay if I share my screen?
Stephanie, you should be able to.
All right. Okay, is everybody able to see that all right? Good, all right. So what we did, the request was we wanted to really look at the breakdown of Black, Indigenous, people of color in the subpopulations, part of our inflow outflow dashboard. So what I did was I looked at, since the inflow dashboard is really looking at our by name list and the folks are active population, as I took last month's January by name list and I broke it all down by race, American Indian, Alaska Native, Indigenous, Asian American, Black, African American, African, Native Hawaiian, and white. And I also looked at all of the households, like the total active number. And then we looked at singles, families, chronic, unsheltered, veterans, youth, and aging. You'll notice right away that there's some numbers that are quite off the all households total. A better way to look at this was went ahead and normalized the data to the all households, so you could really see the shifts here. And you can see right away that there are some interesting shifts in families here, also chronic and the youth and aging populations. So yeah, I just wanted to present this, open it up for maybe a little bit of discussion or questions. Didn't know if we wanted to review the whole dashboard as well again, or if we just want to look at this piece of data. I see Craig. I think Craig has your hand up. You have a question? Yeah.
Yeah, I'm just curious. Can you hear me? I'm just curious when I see, for example, chronic versus singles, are the chronic numbers a subset of singles? In other words, singles add up to 100%, chronic adds up to 100%, but they're not. I'm not saying this right, but they're not all the same people. In other words,
yes. Yes, exactly. So the singles is the entire singles by name list, and then within that is a subset of singles who meet the chronic definition. So that is the chronic category, is those folks who are meeting the chronic definition. On both singles and families, I should clarify.
Thank you.
Mm-hmm.
I have a question, and I think I'm not quite sure how to ask it, so I'm going to try.
Sure.
I understand that how race and ethnicity are broken out in HMIS, but I also think that there are concerns or challenges, especially nationally, around the Latinx population. And again, I understand that that is not, like, Hispanic is not a race, but I wonder if there has been conversation about how we look at that population. And I'd love feedback from other people that might have a better perspective on this, but it's just something that sort of gets me thinking and triggers thought in my head about the importance of looking at that, because I think they're overrepresented a lot of times in poverty, but they tend to be underrepresented in the homelessness response system. And I think there's like good reasons for that, and they're varied.
Absolutely.
I agree. This is Wendy Johnson, sorry. I agree with Chella's question. With Hispanic not being a race, but it is a significant representation of our population, I think we need to figure out how to capture that aspect in this equity reporting, because I agree there's some disparity from what I'm seeing on there. I believe that Hispanic is captured under white, and I would argue that most Hispanics don't refer to themselves as white. So race versus ethnicity needs to be addressed.
Hi, this is Nikki. I just had a question, Stephanie.
Sure.
Is it broken down? Do you have it broken down by ethnicity by chance?
I can do that really quickly. I had broken this down by race just because that was the request. But I can definitely, that is a field on the by name list that I can easily break that out. I think to Wendy's point, I think we want to define what we want to look at. As like Wendy's point, HUD captures Hispanic typically as white ethnicity, Hispanic, Latino, Latinx. But there are other, like now that we have multiple categories too, you are going to have Black African American who are responding as Hispanic. You're going to have other races that are going to respond as Hispanic as their ethnicity. So I think we have it gets a little complicated to tease that out, but I think as long as we're willing to define that, that would be no problem.
Thank you.
Mm-hmm.
Michelle?
My question is, I see that the subpopulation by race is broken out by veterans, youth, and aging. Is it possible to get some type of disability or number?
Yeah, we could do that. Chronic is going to get us kind of close to that because everybody who's in the chronic category is reporting a disability in order to meet the chronic definition. There will be some folks who don't meet the length of time that would also be reporting a disability, and I can break that down too for the next meeting if we'd like to look at those who are reporting disability but not chronic. We can do that as well.
That would be great.
Yeah, absolutely.
So, Sylvia.
Hello, Sylvia from ADE. I was also wondering about a category in race for those who are of mixed race. How are they answering their questions? And then B, is there a breakdown in actual ages for youth that we're covering and also for the aging category?
Yes, absolutely. So for the, let me take these ones real quick. So the youth category is 18 to 24. So I took anybody who is within those birth years. And then with aging, I also went off the birth year 59, and I'm trying to remember, I think I was going off Social Security retirement age on that. So I'll make sure that I get the birth range for you there. What was the first question again? It was for multiple categories?
Oh, yes, correct.
Yeah, so if somebody's reporting multiple categories, it's going to show up, it'll show up as what they're reporting. So there might be some duplication in if they're reporting, say if they're reporting both Indigenous and Black African American, there might be some duplication there, but it would be pretty minimal.
Yeah, so to piggyback on that, because I did the math, that comes up to like 101%.
Mm-hmm.
And so like, what I'm wondering about that from Sylvia's question is this 100% of those who reported, or did everyone that we like, or we have that racial data on everyone?
This is everyone who reported. So these were,
okay, so,
yeah.
So in that, is it possible for us to also see what that other is? And the reason I say that is because when we ran our data at the Human Services campus,
mm-hmm.
the numbers fairly look like this, but then they look like this because I was pulling those that reported. Mm-hmm. There was another like 40%, almost 30 to 40% that didn't report a race, right? And so then that's why, like, when we look at this number, for example, of 29% of those experiencing homelessness are Black or African American. But if I walk through the campus, that number nearly doubles, right? Just the eye test says that number is like 60 to 70%. Like Madison is a Black community. So with that being said, like, I think that's part of, to go all the way back to the first questions that were asked, that's part of what we end up missing in this conversation, both from the standpoint of what our Latinx numbers look like, as well as like really understanding that there may be some additional marginality that we don't fully understand. And yes, there's overrepresentation, but we don't really understand how endemic that overrepresentation is, because the data is set for us to not even have the full depth and the ugliness of the picture. Like, we're just looking at the print and like don't understand like all of the texture that's within it. So like, if that number for like future reference can be set out, that would be helpful, just so we can understand this. Like, there's 40% of the population that we don't even know about.
So what this data is the folks on the active list, the by name list. So what I can do is I can just pop over the number of folks on the active list that haven't reported any race category. Is that what you're requesting?
Yeah, I'm just saying, like, mm-hmm. it's good for us to know and to understand that even in this picture, like, mm-hmm. we get alarmed at some of these numbers, and we don't even understand that these numbers don't scale, right? That these numbers actually jump off the charts and do a completely different slope when we're looking at the real numbers. And so, like, it becomes really easy for us to not understand the urgency of changing our interventions around particular groups, because we just think like, oh, there's some slight misrepresentation, as opposed to understanding like, no, there's a crisis in terms of how like it's not even just misrepresentation. It's like socially criminal or systemically criminal when we look at like what the actual numbers could look like, because we don't even like if we understand, sorry, and I'm talking too much, but it's like if that number, Stephanie, of the number of people, for example, that aren't reporting race is like 30% of the group, and that's just an arbitrary number, right? Then like it helps us to understand like, oh, we don't even know about a third of our population, right? And so these numbers could be even worse than what they are, and a lot of times they are. They don't just perfectly scale because of who those folks are that are not identifying, if that makes sense. Okay. So in the line, Wendy, is your hand just still up, or did you have another comment? Because I've been passing because I thought your hand was still up. I thought it was just up.
I'm good. My hand's just up.
Okay.
Thanks.
Okay, Nikki.
Did you say Nikki?
I meant Ramirez because she
Oh,
had it.
sorry.
And she's muted, so she's talking, but she's muted.
I hit the button. I don't know what happened. Good morning. So yes, no, I would just like to second some of the suggestions that are there. I think it's important that we see who didn't report so we know how much information we're missing. I think that, the information that we're missing on individuals and what their race or ethnicity is, sometimes I agree with everything that's been said as far as, we don't know what that looks like. There's a lot of variables. I also believe that the Hispanic population, if they don't identify as white or if they don't mark other, that they're going to decline to report a race and they're only going to report ethnicity. So if we can see ethnicity broken down into this, I also think it's just important for the diversity, equity, and inclusion work that we're doing and trying to make sure that we have equitable outcomes, that the way that we look at race and ethnicity and mixed race in that setting through that lens, that we would apply it here on this dashboard as well. So if we can just get a little more detail on race and ethnicity and those who are not reporting and those who are of mixed race, I believe that will just help bridge what we're looking at here and what we're looking at within the race equity subcommittees.
Absolutely. Thank you.
Shayla, is that how you said it? Because I know I got it wrong the entire last meeting.
No, you got it perfect. Okay, I guess my thought or comment here is how so this is awesome, and I know that was our request to look at this data broken down by race. And I know that we have this subcommittee, the race equity subcommittee, that's working on things, and we had a strategic plan. But I'm wondering, what are some next steps? Like, how are we going to start looking at outcomes? Like, and how do we move forward? Like, I love that we're looking at this data and talking about it and making recommendations on how the data could be better. But I also think, like, I'd like to understand how we can be part of like moving forward with this data and doing something about our outcomes.
So that would have been my next question. I promised I didn't plant you in the audience to do that. And so yeah, that's the question. So we all see the data. We have questions around the data, but so oftentimes we'll get caught up in the technical components of this data and be like, oh, well, is it this, is it that? And like, what do we see? So what I'm going to ask everybody is, from this data that you're looking at, and like, what does this mean for you all? And what does this mean in regards to like, whether it's new information or it confirms information? What are the things that come to mind as far as that can be done? Yes, there's a racial equity provider toolkit. So there's a whole host of things that can be done and that's been outlined out, but I'm really curious around, as you look at this data, what thoughts come to mind around how you need to change or adapt in the work to address what you're seeing in front of you? There we go. Okay, so I'm gonna start with Jocelyn.
I think just maybe the beginning stages is, just kind of dissecting and looking at assessments and those questions and how they correlate. Some of the questions may affect races differently. And so really just gathering taking a deeper dive into the questions and then dissecting the data around those questions in an ethnicity manner, if that makes sense. I know we've had conversations for the last 2 years that the VI SPDAT, didn't feel racially equal. So maybe just, dissecting those questions and breaking it down by race. Well, what does it look like for the white population for this question versus what is the data around the Black population for this question? So, and then taking the question out if we need to. Making some bold moves, removing some questions if they cause racial disparities or an ethnic group isn't able to, answer those questions appropriately.
Thank you, Jocelyn. Yeah, definitely. Like we're the experts, right? And so it's really this thought around like how do we adapt the work? So thank you, Jocelyn. Michelle.
Yeah, thank you. I have some questions. When I look at these two tables, subpopulation by race and normalized to all households, and I look at the small percentage numbers on the normalized to all households, are these supposed to be related in regard to that? Because when I look at, for example, chronic white, it's 67% on the subpopulation by race. On the normalized to all households, it's 4%. And I'm not quite sure how to interpret that. So,
Yeah.
that is.
Yeah, let me explain that. Oh, go ahead. Go ahead.
Yeah, that's all.
Okay, yeah. So what this means by normalizing it is that we are looking at how far off we are from our basically what I guess you would say our core of what we're looking at. So if you're looking at chronic, they're at 67%. So they're about 4% over normalized to all households at 63%. And then again, when you look at, if you look at Black African-American families, they are sitting at 25% in the chronic category. So they're -4, so they are underrepresented here by 4%. So that's just another way of kind of looking at this and being able to see right away, where the shifts are, right here in families, 15% over representation, you can see right away, right off of normalized to the household. Does that make sense?
Yes, thank you.
Yeah, absolutely. We did run a quick way to look at all of the active not reporting race on our by name list. So we're sitting at about 1% that are not reporting a race.
Okay. Thank you for that, Stephanie. Thank you for that.
Yeah, absolutely.
Yeah, so like this other thought around practices. So I'm thinking like how this informs, so piggybacking off of what Jocelyn said, it's like asking ourselves even what are we seeing when it comes to the responsiveness of who's doing the VI. I know that there's been some work around that. And so asking ourselves, are we staffing that way to be able to support making sure that we have the right population or the right makeup of diversity amongst our staff to be able to get the proper responses that we're looking for. I ask, are you having data conversations with your staff that also tell the demographic story? Or are you just having data conversations with your staff that reflect the numbers? Right. And I say that because critically, being critical of our sector, I think that in spaces like this, we talk about race, but in spaces on the front lines, they talk about socioeconomics and they don't talk about race in the same way. And so are we having those uncomfortable conversations that allow the front line to also build capacity around their ability to understand what's the racial makeup, even being able to understand part of the reason why white is at 63% is so that we can have a white picture of homelessness, right? So we don't understand how groups that are marginalized are mainstreamed in homelessness, right? Like if we're not talking about these numbers in that way, then like this just becomes like almost like an ancestral academic exercise. So I'll go Jocelyn, and then I'll go Shayla again, and then Michelle, is your hand back up?
Yes. One of the things that I'm seeing with this is when I look at, for example, chronic, because that's the area I look at. And then I also see aging. So some of the numbers are very high in disability or chronic and aging. And so if it would help, and I think it might help the public as well, if we have phrases that will explain the numbers and the correlation, the correlation to these numbers, so that they can just pick them up and run with them. Does that make sense? I've seen that in the disability field some, where they explain the numbers in a phrase that they can just pick it up and run with it rather than trying to interpret it. Because interpreting data is not always easy, and when it's correlated, like for chronic or disability and aging, it's like, what am I looking at? Am I looking at that we have a huge population issue with older folks who are, homeless? And so that's where it would have to scale some of the services that are provided, the accommodations, disability accommodations that are provided, and that kind of thing.
Thank you, Michelle. Yeah, definitely, that's one of the things that we can do. So I'm gonna take these last two comments, and then we have to move because we have to complete the agenda. And there's other things that are great that we need to dive into in this agenda. So Jocelyn first.
Just really quickly, Richard, thank you for articulating exactly what I was trying to express originally in my first comment. But I believe it's important just visually, just being on the front line. When I was a frontline worker, a housing specialist, you could visually see that more Black folks were receiving rapid rehousing services versus permanent supportive housing services. You could visually see that in the briefings. There were more Black people in the rapid rehousing briefings than there were in the permanent supportive housing briefings. So that's a visual apparent disparity. And it's an assessment issue. So, and I just wanted to say thank you for saying that. And it kind of speaks to, what are these assessments saying? What is the question that's being asked to where we are clearly seeing a divide in Black folks being receiving rapid rehousing versus permanent supportive housing? To me, that is a clear-cut issue. It's visually seen, and then it's an assessment issue. And so we just got to dig deep and figure out what that is around this data. And then that's it for me, guys.
Thank you. Shayla.
Right. So I want to go back to my action thing. And I guess, and I don't know if Nikki Stevens has an answer to this or who might be the right person, but so there's been some really compelling comments. Jocelyn just said, visually, we can see that, Black people are getting rapid rehousing more than they're getting permanent supportive housing. And the data shows that too. And that's a national thing. So I'm wondering, where do we start? And is there a plan to actually say that? And is that a good idea? Maybe we pilot in a small area and we say, hey, we know that this is true. We can see it in the data. We can visually see it. Can we start here and start tinkering with these ideas and start saying, okay, why do we see more Black people? Because in permanent supportive or in rapid rehousing than permanent supportive housing, I get, we need to see the whole system. I understand that, but I'm wondering if we can take a small chunk and start looking at that and investigating the data and the qualitative and quantitative pieces around it, talking to people with lived experience of homelessness or that are in those systems and start figuring some of that out. Is that plan already set, or do we have an opportunity here to maybe make some recommendations and state that? That's kind of what I'm wondering. We see these things. Let's go.
Nikki, how does that how does that comment feed into the work that the racial equity group is doing?
I think it feeds directly into the work that we're doing. I'm open to any recommendations that you all want to make and how we move forward. We are meeting, we are discussing those things. As we know, we know the tool is creating these inequities. So, you know, our next steps are to talk about how we make some changes. So any recommendations that you all have, or if you'd like to join some, you know, a smaller work group that we have created and would like to start moving in that direction, I'm 100% open and grateful for this conversation, as you all know. Where my
I'd like to
passion
join the
is.
work group.
Okay.
So
I'll make sure that you're included.
Me too, Nikki.
for those
Okay,
that would,
wonderful.
for those that would like to join the work group, please reach out to Nikki. TJ, I'm going to feed into the next part, and you can dovetail your comment that you're about to make into that, just because we got to move because I've only got so much time. But I just wanted to say to you all, thank you for the robust conversation. I encourage us to continue to move towards action, though, and really thinking about what we can do with this information. And when you're in your subcommittees, think about what are the things that, yes, need to be sent to the committee for the update from the packet, but what are the pieces that you all are having in these great conversations in subcommittee that need to be brought verbally to us so we can make space and room for that in the agenda, and we can get into some of those action-oriented spaces. So TJ Reed is back to give us an overview on evictions and the data that is available. After TJ's presentation, again, we'll have discussion about how to better understand the challenges around evictions and how we around the table can combat. That means action. So let's think of the action steps, the rise in homelessness. Go ahead, TJ.
All right, thank you. And the only other comment that I was going to make on the last item is MAG is finishing up a RFP for an evaluation of coordinated entry. It actually closes today, which within that RFP, the contractor is meant to work with the community to recommend different and adjustments for the assessment tool to focus on race and equity. So I would encourage anybody to join the coordinated entry subcommittee as well as an opportunity to work through what that will look like, as that is tangible action related to the discussion that y'all were sharing. Okay, so I'm gonna blaze through this so you can have a lot of time, but we wanted to give you a brief discussion around evictions in Arizona. Next slide. So what we'll do is look at some state data, then some local data to the county, and then some takeaways here. Next slide. So first, we just wanted to share first a shout out to a professor at U of A, Keith Bentel. He has done a lot of analysis on the census pulse surveys, which are surveys that come out every couple of weeks from the census that are really trying to track progress and issues during the pandemic. And so in Arizona right now, there are about 12% of renters that are not current on their payments. Next slide. And sorry, y'all, I have a bit of a cough, and it's not the raspy, smooth jazz sort of vocal. It's like the annoying cough. So I apologize if I cough into all of your ears here. So this one, in light of the conversations on race and equity, there was some concerning information that came out related to those who are behind on rent. So those behind on rent, one thing that wouldn't be a surprise is they're predominantly low income, but then 72% of those behind on rent are people of color. And so again, that may not be a surprise to some of you, but that number is quite staggering, and that is nowhere near the general population breakdown. And then of those who are behind on rent, 55% are unemployed and 50% are households with children. Next slide. So this slide just kind of shows a couple of things that are really interesting. The left side shows how many months behind rent people are, with the majority of people actually being 8 or more months behind, which is quite concerning. Or not the majority, but the biggest percentage breakdown of that entire group. The next shows how few people have actually applied and received rental assistance. It's great that we're getting rental assistance out the door, but we need to understand that there are so many people in need of rental assistance and so few people who are actually getting it. Next slide. So this slide just shows of those who are behind on rent, roughly 24% of them say they're very likely that they will be evicted in the next 2 months. So that's basically a fourth of people who are behind on rent think that they are very likely to be evicted. Next slide, please. And so what does that look like for Maricopa, right? So there's a lot of information here, but I would look at the bottom part. So the estimated number of Maricopa County household behind on rent is roughly 54,000. That's a debt of about 146 million with an estimated rental debt per household of almost $3,000. Next slide. This slide shows estimates, and I want to be very clear here to take this with a grain of salt. There's not a lot of good data around of people who are evicted, how many in terms of percentage will become homeless or experience homelessness, but this kind of breaks that down. So if you're looking at the top one shows a 10% displacement. So if for whatever reason that 54,000 who are behind and facing eviction actually do get evicted, that's 5,400 people or households. And if 10% of those, you can see the far right side, that's about 1,400 new people who would become and experience homelessness. So this is really just to say that evictions do have an impact on homelessness. We don't quite know, but even if the numbers are quite low, it does have a massive impact on who is experiencing homelessness. Next slide. This is the data that was produced by the Maricopa County Justice Courts. So you can see that December of 2021, there was a pretty big spike from November, but we are yet to be at pre-pandemic levels in formal evictions. I'm going to tell you why you want to take this with a grain of salt in a second. 4,400 is a lot, but it is nowhere near what we're really seeing out there because of other factors that are sort of masking evictions. Next slide, please. This map just kind of shows a breakdown of where these evictions are actually happening. Red areas being over 1,000 in 2021 and the blue areas being under 100. Next slide. One thing that we have seen from Real Data Incorporated, it's data related to units that are 50 plus. There has been a 20% increase just in 1 year from Q2 of 2020 to 21. And some other data suggests that it's even greater than this. It's just to show that this is a contextual data item, that rents are just skyrocketing. And I'm sure if you've talked to anybody who's renting, they've probably told you about this, like, hey, I just renewed my lease for another year and I'm paying $200 more or $150, $250, $300 more than I was paying last year. Some even more than that. Next slide. So what I want to highlight here is, yes, eviction rates are still below pre-COVID levels. That is in conflict with the projections of data. As you saw, there are thousands of people at risk, and those numbers are not anywhere close to what we're seeing on evictions. So one thing that we are trying to do, and I want you to keep your eyes on, and some of these are not secrets, is rent increases do not count as an eviction. So if you're at the end of your lease and your rent goes up $200 and you decide to go somewhere else, that's not listed as an eviction. That's just you're not renewing your lease, right? So a lot of people are effectively just being forced out because of that. There are also non-renewals that are happening, people with vouchers, people who are renting, where they're just told, we're not renewing your lease, so you need to leave. However, again, that does not count as an eviction. That is a non-renewal, right? And then there have been a substantial amount of property ownership changes, which yield a lot of movement without being considered evictions. I will say I've had really good conversations with our partners at Home Inc. And just this last week, Mike shared that he would give some data related to what they're seeing within the Section 8 vouchers and how many non-renewals they're seeing. Projections, I believe what he told me was 64% of those that they oversee in Section 8 housing are going through non-renewals. I just want to let that sink in for a second to share that is awful. 64% of all the Section 8 that they, and obviously that's one program, right? Home Inc. does not oversee all Section 8, but like in that tells us something, right? That there are other stories here. So I would encourage all of us. And one thing I think that MAG is going to be doing is trying to supplement this data with a lot of other sources to be able to tell the full story of what is happening here. Because it's not just, if you just look at the eviction numbers, we're going to be grossly misinterpreting the current situation. And that is something that I think our elected officials, we need to ensure that they're hearing as well. Because if they just say, oh, hey, by the way, y'all, our eviction numbers are not even pre-pandemic levels yet. Yay, we're winning, right? It's like, no, that is not what is actually happening. So we need to make sure we're doing our due diligence and gathering every single contextual piece of data to understand that the problem is growing and is considerable. As you see with some of our homeless numbers spiking and some of our early projections of the pit being pretty scary. Next slide, please. All right, so as you all know, I put Katie's information here. My last day is Friday, so please reach out to Katie if you have questions ongoing for this. MAG is going to continue to work through this and work with our partners to make sure that you're as informed as possible, because this stuff does impact us greatly, right? It's not, evictions are not actually like homelessness, but it definitely impacts based on what we're seeing. All right, back to you, Mr. Chair.
Thank you, TJ. So we already have hands. This is great information. I'm going to start with Wendy.
Excuse me. Thank you, Richard. The New Times published an article just this week on this, and we're up in the high 5,000s of filings last month by landlords. And that is only 1,000 short of what it was pre-pandemic. So the arc is there, and I think it's going to go up higher. The non-renewal is the hardest part for us to deal with. And I'm not sure that, and we don't know why some of these folks have applied for rental assistance and not been helped when we keep being told there's lots of money. So I'm trying to figure out how we can prevent homelessness by using this data and what's available in Maricopa County for rental assistance.
That's it. Thank you, Wendy. And I don't know if I have an exact answer to that question, but I think this group should really talk about that as tangible next steps of what are areas that we can make an impact in terms of whether that's advocating or whether that's programmatic shifts, or how do we start to adjust this? Because some of this is on a macro level and a policy level that needs to be addressed as well as a micro level. So lots of different options here.
Thank you, TJ. Nikki Ramirez.
And I'm off mute. Thank you. I do agree. There are shifts that need to be made at a macro level and a policy level that greatly affects everyone in this group and the work that we're trying to advance. The work that we do is very difficult. It's not been easy to house people in rapid rehousing programs and permanent supportive housing programs through the pandemic. And the way that the real estate market is shifting, it's become increasingly more difficult. And so not only is it difficult to place them, it's difficult to have our workload amplified by those that we are having to relocate because of these non-renewal notices and the rent increases where they're being forced out. And so there are policy issues that I would like to see us, explore. I don't know what that would look like within this group or how we advance that, but source of income laws would protect those with housing choice vouchers from being discriminated against simply because they have a housing choice voucher. They can still be discriminated against or screened out in rental selection criteria because they have negative rental history or because they have criminal background that doesn't meet the criminal background screening criteria within a landlord, but not simply because of the housing choice voucher. I think that there's also work that has to be done with the public housing authorities to look at the fair market rents. When small area fair market rents are able to be utilized, and HUD is already releasing those small area fair market rent amounts per zip code, we need to look at how we can lift that, because that becomes a barrier. Landlords hide right behind or right above that rent amount where they're not telling the client no, it is their rent amount that's telling the client no. And so there's just these barriers that greatly hinder our progress, that we could correct from a policy standpoint. And I would just love to see us advocate for that and to truly create the picture of the why behind the what, of the faces of the families and the individuals that we serve that are impacted by this and what this looks like. And this is greatly impacting the aging population. Going back to one of our earlier topics on the agenda, looking at the aging population. When I look at the aging population, that's 62 and older, because HUD has housing programs that are specifically for those 62 and older. So I like to see where we can plug potential clients into those housing resources specifically for that age group. And in looking at that, I can tell you right now, we serve many clients across the valley that are seniors who are receiving non-renewal notices or rent increase notices that they cannot afford these rent amounts. And so seniors have always been a target population for CPLC as an organization, and they're experiencing housing instability at a greater rate. They're at greater risk for homelessness. And there's always all of these other issues that they're challenged with, that we are trying to assist them with, and housing wasn't necessarily one of them until the real estate market shifted in these last, I would say, 2 years. So I think that there's this huge storm coming if we don't start pushing the advocacy for these potential solutions and why they're important to us. That's all for my comments.
No. So very true. So very true. Thank you for that. Shayla.
I just had I agree with everything Nikki said. That was phenomenal. But I want to comment on the eviction piece too. I think something that I'm curious about, like, TJ, data is so powerful. I keep saying that, and like all the things that you showed. And I think one of them that was really interesting was the zip codes, or the area, the zone map of where the highest evictions are. And there's some great work being done across the country on targeting those zip codes particularly, and getting the CAP offices and all of the prevention dollars together and really, really targeting those zip codes. And guess what? Most often, what we found too are that those are the zip codes where Black and brown people live. And so I think that'd be interesting to get more information around that. But like, I mean, that's a good way to look at, that's an opportunity to look at some of our like race equity work, and also just how do we tell that story. And granted, I know we don't have control over all of the prevention dollars out there, but we can tell the story, and we can help bring people together. And I'd like to see if there's something we can do around that.
Thank you, Shayla. Josh, well, hold on. Before Craig, you put your hand down. I saw you were in queue.
Yes, I got my question answered for that.
Okay, cool. Jocelyn.
I was just curious on a policy level. I know on some of the questions they ask for rental assistance, you have to prove that you've been affected by COVID in order to even receive that rental assistance. So with the numbers of, the amount of non-renewals, is it possible that we could look at adding rental increases as an effect of COVID, and folks, being able to receive that rental assistance on the fact that their rent has been raised $300 to $500 and they can't afford it, in preventing or supporting them to be able to stay in the unit versus having to move out. Is there a conversation around adding that component into the rental assistance question? I hope that made sense.
Hi, Jocelyn. I'm actually not sure some of the logistics, and there may be other people on the line who would be better equipped to do that. I did want to just mention real quick to Shayla's point too, and I think partially to this, I know that our CAP offices and eviction prevention providers have been doing some of the focus on the zip code targeting. We worked with the city of Phoenix and some of the others around doing proxy mapping for identifying areas of high risk. And that was not only for fast tracking applications, but for targeting marketing and making sure the information gets out there. It may be, I don't know how it would play into this committee, but it may be wise for this group to hear from some of the municipalities administering emergency rental assistance and CAP offices to see if there's a place to plug in. We want to supplement and support the work and acknowledge what is happening already. And they may be able to, and somebody on the phone may be able to better answer it too, Jocelyn, but I'm assuming that direct question has been explored. I am almost positive, because the thoughtful conversations I've had with them, it's like, how can we do literally anything to make this process easier to get money out the door to people who need it?
Yeah, I think that would be a really good, Katie, like that could be a really good agenda item for next month, is bringing in the CAP offices to talk about the rental assistance and what's available in that space and what they're doing there. Yeah, I'll get Kathy, and then I have a comment after that.
So just wanted to let you know, we at a newly run Mesa Can, the community action agency here in Mesa, but I'm also chair of the wildfire board. The wildfire formerly was the Arizona Community Action Association. So if you need me to contact anybody, because I have regular meetings with all 11 CAP directors, I'm happy to do that or participate in any way that you see would be great. Just wanted to offer that as a resource.
Thank you. So, there's been a lot of calls here for action. What do people want to do around this? What do people want to dig in? So I'm going to ask that question directly to you all. Like, I know what you're feeling. What are you thinking? Like, what do you want to do about it? You see the information, but what do you want to do about it? Whether that's individually from your organizational context or collectively, what is your call for? You've got all of these people here. What do you want to do?
So I will be the first to, can I just jump in? Sorry, I didn't raise my hand. I just realized. I just wanted to say, I think that I've been on this committee for a little over 2 years now, if I'm not mistaken, but I still sometimes don't understand what we can do or what would be outside of the scope. And I know we've got a lot of new members as well. And so I think maybe some information and or discussion around what the options are and how far we want to go within those options, where everyone is feeling comfortable, would be helpful. Just the information as far as what we can do, how far can we take this, who can we include? If we're gonna include the CAP offices, is there a time in which we can talk to the public housing authorities? Is there a time that, or within MAG, if there's policy work that's being done, or that we can explore as far as the advocacy work that we can do? I'm not exactly sure of what the limits are there, if any.
Just really quick to that, I might get in trouble for this, but Nikki, like technically we can do anything because there's what we can do within the COC confines and constraints, and then there's like how we also organize outside of that and beyond that, and then understanding who can be in those spaces and who can't be in those spaces so that we can make those types of things happen. But I mean, we can technically do anything, and there's certain things we can talk about here, and then certain things we can just get on the phone or get in person and talk about at another time. So, but the limits are like whatever we need to do, we can do to get done. So I just wanted to say that first, and then I'll go to Katie because Katie's like a technical answer, and then I go to Marcy and Vanessa.
Thanks, Richard. To kind of expand on that, you all as a committee are an individual body, so you all can choose what to do, and then you all signing on as individuals or as a group is kind of up to how your agency decides to handle that. So I would defer to you all to ask your superiors or maybe even yourself as to what, like as far as advocacy goes, what you can and cannot sign on to. And then as far as I think, Nikki, your other question was who can you involve and who can you pull in? That is up to you as well. Like, we will take direction from you. As if you want a presentation from Catholic, we will do our best to get the right person in the room to give that presentation. So we just need direction from you all. And Co-Chair Cruz and Johnson have been really kind of defining a lot of where that goes, of saying, yes, we want this presentation and this is really helpful. So I hope that answered kind of both of your questions.
Thank you. Marcy.
My question, being a newbie here, I keep hearing of various subcommittees, but is there actually a list of all the subcommittees? And I want to join them all. I don't have time to join them all. But I think that would be helpful, especially because I would want to use, my abilities in the best light, or to give the most positive impact that I could, especially when we're talking about action and advocacy. So, is there a list that I'm missing, or maybe I just missed the communication where it exists?
Katie, did you want to answer that?
I can answer that. There is some information included in your packet. One thing that we had shared with us is that there's a lot of resources on the MAG website that you all don't know how to find and don't know where they are. So they are linked in your agenda packet under the update. And we can also, there is currently a list on the website, but is in the process of being updated of all the work groups going on. And so I can finish updating that and get it out to the committee as a whole, as well as get it updated on their website.
Thank you.
Vanessa.
Thank you, Richard. So I think when it comes to the evictions, there's it's such a systemic issue, but we can, I don't know, as a group, since I've been on this committee, I'm not sure how much advocacy we have been doing policy-wise with local governments, but I really think that that's something that has to happen in order for there to be movement on this, because there's dollars in all of our housing programs, but as we see the inflow increase with evictions and we see people, the non-renewals that TJ was talking about in our housing programs, and we're not able to rehouse them because there's not enough housing stock or housing stock that is affordable for our clients. There has to be advocacy there. So I don't know what this group can do and I'd be happy to be a part of that brainstorming session of what kind of advocacy can we do to pull our all of our collective organizations, because we have just such a great group here that we can really get together and say, talk to our representatives and say, this is what we need. The second thing is with eviction prevention dollars that are out there. I think Wendy was saying earlier, we keep hearing that there's a lot of money out there that's not being utilized, and we know it's because of the red tape that's around that. And how can we advocate and show that removing some of that red tape will still get to people who need it most. If you check out at ABC now has the contract for access housing programs, and part of that are eviction prevention dollars. Not that much. We have a pretty small pot of money, but I'll tell you, we have done our best to reduce barriers to access to those funds. And on the second day of every month, about 100,000, probably a little bit more. There's a dashboard on HomeInc's website if you want more information. But we spend that within the first 48 hours. We are getting so many requests for eviction prevention, so we know the need is there. And so I think as a community, again, just we need to advocate for reduced barriers to that funding. And then also, third thing would just be we need more affordable housing development and more organizations involved in that, because the more that we can develop, the better to have those LIHTC properties, other affordable housing that to add to our inventory, because we can't solely rely upon the private sector to provide what is needed. So that's it. Thank you.
Thank you. So a couple of things. Katie, when it comes to our legislative update, can that actually be more of a policy update? So it covers both the things that are happening at the legislature, as well as new things that may be happening from a municipal standpoint or county standpoint in terms of policies that are being passed or bills that are being passed. Is that possible?
I can follow up with the Arizona Housing Coalition, who provides that legislative update, and ask about next steps.
Okay, awesome. Secondly, Vanessa, I think it would be great to convene a conversation of organizations that have those dollars so that we can all look at what are the best practices that we're doing or not doing, what are the barriers that we're experiencing, who in the room feels like their hands are tied even though there's no rope there, right? And like really being able to dig into that so we can unlock all of each other. I think that would be amazingly helpful to do. I don't know if you want to pull that together or somebody else wants to pull that together. Somebody else, I'm talking to myself if you don't want to do it. But I think like that would be a really good conversation to have because the HSC is sitting on $3 million that we're about to unlock over the next 3 years with eviction protection and moving assistance dollars. And I think that conversation around making sure that we're removing the red tape is really important so that we can all really help the populations that we're saying that we want to serve.
I think that's a great idea, and I'd be happy to help with that as much as possible. It sounds also like if whoever is involved in in those meetings with the CAP offices, and I know that there's funding outside of the CAP offices, so yes. Absolutely, I'm more than happy to get that group together.
Okay, so let's wrap afterwards. Okay, it's 7 minutes. Michelle, I saw you had your hand up. You're good? Okay, so we've got some things moving and rolling. You're good? Okay, so we've got some things moving and rolling, but again, think about this. Really like that point that was raised around like what I call the Casper, the not so friendly ghost evictions, right? That are like where people are being evicted, but it'll never show up on the data. Like we've got to be the ones to push those conversations in places of power so that we can like help serve our populations, because the picture doesn't look as bleak as it is, but it's like, it's a crazy picture, right? Even the picture as it is crazy, but like when we understand what's not being captured on the data, like it's even heavier. So definitely like, let's make sure that we continue this piece. Okay, so the next part, the ESG committee is responsible for overseeing the ESG and COC written standards for administering assistance as seen in the agenda pack, okay? We are looking for volunteers to join a work group to review these written standards and bring forward recommendations to the committee in March, right? So like some of y'all have been like, oh, I want to get in, you're playing double dutch, this is your time, right? Sorry, to join. So yeah, so we're looking for the volunteers to join a work group to review these written standards and bring forward recommendations to the committee in March, which will be given to the ESG subcommittee. If interested in participating in meeting in the next 3 weeks, please email Katie. Katie, just raise your hand because we all know. Okay, there we go. Email Katie, and if there's any, so that we can get that done, because that's not the so sexy work, but it's the work that we all necessarily need in so many different spaces. So, do we have any questions about that?
Richard, can I just share? Part of those administering assistance is specifically the timeline of rapid rehousing. So providers, your voice is really needed. If you think 3 months is too short, this is your time to give voice to that. So if you would like to be part of that, feel free to reach out to me. Thank you.
Okay, so so reach out and she'll be there. Okay, awesome. So the next piece, I hand it back to Wendy. This is Wendy's part. Okay.
Thank you, Richard. Thank you, Richard. You always do such a good job. Do the committee members have any additional action or discussion items for future meetings? We've thrown one out there right early on, but are there any else?
Yes, I don't know exactly what the action item would be or the discussion, but I brought it up earlier. I'm extremely concerned about the rhetoric that is going on about homeless people in our community. And I do understand that we have to be careful politically, but I do think that there is a need to respond to that kind of hateful language that's being out there. And I'll just say that, I mean, it's homeless policy of a gubernatorial candidate running for governor. I think there are other examples of that too. So I'm not suggesting that we go out and attack any particular candidates, but I am very concerned about the language. And I want to know how we as a committee or as MAG or not MAG, I'm sorry, as the COC, as the regional committee, continuum of care people working with homelessness can respond and make sure that people experiencing homelessness are treated with dignity, and some of the things that are said are really inappropriate. So I just don't know how we deal with that, but I think we need to combat it.
Thank you. If anybody wants to see what's happening, you can email me at wendy@justicecenter.org. I've been receiving copies of everybody's campaign platforms and things that they've done. I think us taking a stand on the attacks are such that it reflects on our work. And I think that we need to consider that and how to address that. So I don't disagree, but I don't know how to put that on there. Richard and I will explore it with Katie and see what we can do. Craig, your hand's up.
Yeah, this is a little bit related to that topic. I learned when we got the zoning on our new hotel, Project Haven out at Northern and the freeway, I learned an awful lot about how important neighborhoods are and acceptance of neighborhoods. We had neighborhood support for that facility. And I am convinced that one of the roads to solving homelessness is going to run through neighborhoods. And part of that is because neighborhoods are dealing with a lot of the impacts of homelessness. And I have heard, to go backwards to what was just said about rhetoric. Well, let me back up. Same thing with the same point stands with the Phoenix Task Force. We have been struggling to find out who are the people who are, and I don't like this term, there's a better term to use, but who are service resistant. Somebody on here I'm sure has a better term. I've heard different terms, but they slip my mind at the moment. But I feel like we don't know who the people are. Who are the people who are, quote, service resistant. I've become a little bit clear that different parts of the city have different, the homeless population or the encampments are people with different issues. I know certain areas that have more drugs than others. I know certain areas that where people are refugees from society in many respects because they've lost their economic resources, but they're not criminal and they're not drug addicts or anything else. And I really feel like if we are going to be able to counter things like Carrie Lake's comments the other day or other comments, that we really need some good data as to who it is that are in encampments, and just what we think and our anecdotal comments and thoughts is not good enough, because there really is a significant split that I see politically between neighborhoods and homeless people, and it's becoming more polarized. And I just think that I don't know how to answer this or what to do about this, but I would really love to see us figure out how to really get a good feel for who it is that, for the nature of the population and different areas. I was reading a study the other day about where an individual did a study that said crime doesn't go up around encampments. But the disclaimer on that was that he didn't do any study on different subsets of encampments. He just did a study on sort of a citywide, this was another city, a citywide study on crime and encampments. And I just think that, in my observation, is there are different populations of homeless people that cause different impacts and are more and less reachable. So I guess I just want to say I really would like to see a good definitive, I say definitive, that's a strong word for it, but a good study as to what who is it that is not willing to accept services right now, and what do we, because that'll lead us to some of the answers, frankly. And I just wanted to say that the Phoenix Task Force is focusing a lot on this population, and frankly, we're standing on one leg. We don't have a clue, and I'll just leave it at that.
Craig, for clarity, who is the Phoenix Task Force?
The Phoenix Task Force was appointed by the city manager. It's about, I don't know, 15 people, and it includes neighborhood people. It includes advocates. It includes people on various agencies, well, that's what it is. It is going to have a report going to the city council, which, depending on what the city manager does with that report, how much he edits it, is going to be approved by the city council. There'll be a lot of questions, a lot of discussion, and but it will result in City of Phoenix and a lot of City of Phoenix policies. And so, well, it'll result in a lot of City of Phoenix policies, and it's probably maybe 4 to 6 weeks away from going to the council. But yeah, so I'll leave it at that.
Thanks, Craig. Let's go ahead to Michelle Stokes.
Thank you. One of the things I'd like to see after just being on this group for a while is a disability deep dive. We're calling folks in this category chronic. They're saying there's not enough data, or it's self-reported. There really needs to be more information in this area, because when we're talking about accommodations and we're talking about what folks need in order to live effectively, it really makes a difference to have that data. It's very difficult to get that data. I understand that. But that is a population that tends to get muddled, for lack of a better word, in how we're addressing these things. So I would like to see a deep dive, or even if there's a committee that's already addressing this, I would like to know about it.
Thank you, Michelle. We will definitely add that to the list. Nikki Ramirez. Come on down.
I think my mouse is not working today. I'm having issues with my mute button. I wanted to piggyback on Shayla's comments on the information that we need to get out into the community regarding what people experiencing homelessness really do look like, or what homeless service programs really are like. And so I was wondering whether or not we can explore, maybe through the data subcommittee, getting good information out about what is the average cost that we're able to resolve homelessness with? How many clients have we served? What do their demographics look like? I think sometimes the best combat to bad information is just putting good information out there and having good information in the hands of the community at large. And so if we can take a more proactive approach, not just through the MAG website, but if we can share our data and demographics, maybe through a social media campaign ongoing, maybe that's led through one of the subcommittees, and we just make sure to share the good data that we do have regarding how successful COC funded programs are, how we end homelessness, what our positive exit rates are, and just highlight what these programs really do look like, what the people going through the programs really do look like, and try to combat it that way. That's all.
Wonderful, Nikki. Thank you. Richard, I think your hand's up.
Just because I know we're over in terms of time, so I just want to say that for those of you who looked at the transient death list, last year we had 550 people that were experiencing homelessness that passed away while experiencing their homelessness. And those are the 550 people we know about. Last year, we were like, wow, this number is too high. And it was at 555 last year. So this number is still too high. And so I just want to raise that awareness for folks, as well as of our last count, which was last week, unsheltered around the Human Services campus, there's 752 people currently unsheltered. That does not count the 660 people being sheltered on campus. So our numbers are really high right now, and I just want to draw attention to the rising wave. That's it.
Thank you, Richard. Those are devastating numbers. Melody Boyette.
Yeah, I just wanted to piggyback on Michelle's statements there in terms of looking at the higher level needs grouping that we have. We do have a work group collectively looking at that, but we are seeing a big increase, at least in the VA and veterans that can't live independently and are homeless because of complex medical needs. So this is a intersection that we're seeing that definitely needs more attention and care, because there just isn't the funding to help them. A lot of them really need like assisted living or those sorts of facilities, and as a result are living on the streets because they can't sustain themselves in our programs or even community programs, and therefore being homeless. So we definitely need to highlight those groups and find a way to care for them, because all techs and a lot of other agencies that we consult, there's an extended delay, and it is actually exacerbating the situation with those that have really serious medical needs. And I say that something that we're actually tracking now at the CRRC, just so we can start seeing how often this is occurring. And because we're saying at least 3 or 4 times a day when we're evaluating a veteran that has this issue, where we can't place them in our programs because they can't be independent. So I think that's something that definitely needs more attention and time.
Thank you. I couldn't agree more. We are seeing it at Justice Center as well. So I don't see any other hands. Oh, got one, Jim.
Hi, how are you? This is, I guess, under the newbie category as well. Do we have a communications subcommittee? Because I've, being in that profession, I'm just itching to, really think through, what do we do as a group communications wise? What do we do as, individuals communication wise? And then as the organizations that we represent. And I think, maybe something like that would be helpful to, answer some of the questions that are out there, and how to get the word out that needs to get out about all the things that we've been talking about today.
That's a great question. I know that MAG has systems in place for communicating as an organization, but we as a committee do not have. And we will add this to our discussion for an agenda, because communication is key. And this group has a lot to say and a lot to share. I mean, good stuff. So let's get it out there. All right. Anyone else? By the way, were you volunteering, Jim?
Yes.
Okay, good. We'll keep that in mind. Anyone else? All right. I have summarized everybody's comments. We need to form a response to the hyperbolic characterization of individuals and homelessness. We need good data, good public information reflecting the positive aspects of ending homeless, the success of our COC programs. We need to work on community data to increase why we have service-resistant individuals and what are we doing to address those. And those with disabilities, reported or not, are being underreported and difficult to extract. So we need to do that. There is an increase of individuals needing a higher level of care, and the process is difficult. And we have people dying on the street. 555 one year, 550 last year, and 1,400 people just around the Human Services campus right now, all at risk for any form of life-ending activities. So added to that was Jim's volunteering to help us with communication. I think that Richard and Katie and I will sit down with Jim and talk about that, because us having some intentional ways to share with the community would be a good response to bad data. Anything else? Thank you, everyone. So for our final is just comments from the committee. Is anyone that has any other announcement or events they would like to highlight? Don't be shy.
Nikki's hand is up.
Oh, go ahead. Thank you. I couldn't see the hands.
So I regret to inform everyone on this committee, this will be my last committee meeting on the committee. My current proxy will be taking my place. That's Jerry Pena. He is our director of DECOLORES, our Domestic Violence Services program. I will be exiting the organization. And sorry, my dogs are barking in the background. I'll be exiting CPLC as of March 1st. And so I will no longer be in this position. It has been wonderful serving on this committee with everyone and seeing all the transition in faces and people who are so very passionate about the work. And so I'm going to miss everyone. I promise to find my way to sneak my way back into one of the subcommittees or some other adjacent role within the COC, just to still keep involved. And I look forward to crossing paths with you all in the future.
Wendy, you're on mute.
I am. Sorry about that. Nikki, thank you so much. You will be missed, and we thank you for your contributions and hope to see you back here in your new role, whatever that is. Great success for your future, which is a great segue. Before we close, TJ mentioned it, but I want you to know that he is leaving MAG, and we want to say a huge thank you for all the work he has done and the energy he has brought to things that don't always bring energy, like data and detail. He will be missed. He will be continuing to do great things while working for Maricopa County. TJ, do you have anything to share?
Not too much, but just it's been great working with all of you, and I look forward to working with all of you in this new sphere. I don't think I'll be too far away, or that I won't see you all. So this is more of just like a see you from a different lens conversation. But it has been a pleasure working with you all, and I love the energy that this group brings, and hope that you can keep moving it forward, and getting some real stuff done over this next time period. Thanks all.
Thank you, TJ. We look forward to dragging you back in. We appreciate your insight and your lens. Is there any other business? Speak up, because I can't see hands on my phone. Wonderful. We thank you for this. Again, in Richard's words, robust conversations. We're excited about this committee. And we're excited about what you want to accomplish. So thank you for participating today. And if there's no further business, the meeting is now adjourned. See you next month.